Good morning. It's Sunday again. Sunday Mobility and Stretch with Natasha, Blackstar PT. Today we're doing a full body stretch. We're just moving today, just grooving. Just want to give all our joints, all our body parts, some love. So we'll get started in standing. We'll start with the back, upper back, add some breathing, and then take it down to the ground. So whenever you're ready, we'll get started. Hopefully everyone's having a great morning. A great Sunday. It's Sunday, self-care Sunday, so get some rest. If you can do this now, that's great. If you're watching the replay, thank you very much and enjoy. So starting in standing, why don't you take a breath in and reach up and then breathe out. So we'll do 3 of these. In through your nose, overhead, blow it out. And again, and out. Okay, this time I'm going to turn to the side. I want you to reach up. Hold your hands up top and reach back. As you breathe out, come in, touch your toes. We're not doing yoga. I don't know yoga, but we'll add a little bit of that movement. So coming up, breathe in, reach overhead. Hands together. I want you to reach back as you blow that air out. Let your body move what it can do and then reach down to the toes nice and easy. Breathe in. Breathe in as you come up. Reach back. And then let it fall forward. Good job. One more time. Breathe in. Take it overhead. Reach back. And come back. Good. I'll face you. So back to reaching overhead. I want you to take your left hand, grab your right wrist, and gently side bend and open up that right side. So today my legs are together, just opening up that side. Good. I want 3 breaths here. In through your nose and out. And again, in through your nose and out. One more time, in and out. Good, back to the middle. Reach backwards. Come back. Now, left hand is on right wrist. Side bend to the left and reach. Actually, I'm side bending right. Good. And again, breathe out. In through your nose. And again, breathe out. Good. Using that breath. So breathing, that deep breathing, that breathing that you can hear helps bring oxygen to our muscles. We need that oxygen to help with any type of soreness, any type of tightness. So when you're doing that breathing out, make sure you're just breathing that air out. Good. So one more time, I want you to reach up overhead. My right hand, left wrist on right hand. Side bend, breathe in 3 times, breathe out, and again in and out. One more time, breathe in and breathe it out. So last time to the right, reach up, right hand on left wrist, feet together and side bend. Good morning everyone. Side bend, breathe in and out, and again in and out, again in and out. Good morning to everyone who joined. Just doing full body stretch, just giving our body some love. Starting in standing, we'll take it down to the floor. I'm just doing some back bends with breathing. That breath, as we know, I want you to widen your stance a little bit. That breath helps to calm our nervous system down. So in this situation, yes, hopefully you feel calm, but in that case, I want that oxygen to your muscles, help with any type of soreness, any type of tension. So if you're feeling tight when you breathe out, you're literally just letting that go. So widen your stance if you can. Your feet are a little bit more than hip distance. You've seen this one before. I want you to start up tall, and then I want you to bend over hip hinge. If you saw my funny reel, I talked about hip hinging, so from the waist. So we're just here, we're reaching like you're gonna touch your friend, give them a high five in front. I want you to first stay here and just reach. I'm gonna go to my side so you see what this looks like. Okay, so I'm starting tall and I'm just bending over, hip hinge, hip hinge, hip hinge, and I'm reaching. I want you to reach, so I'm gonna try to touch this wall. My butt is here, my legs are long as this doesn't bother your knees. If you're hyperextending through your knees, like it feels like it's bowing, I want you to bend the knees a little bit so you're not all the way locked out. So if you cannot control this, you feel like you're going backwards, then bend it a little bit and just reach forward. Reach, reach. So my butt is pushing back towards this back wall and I'm reaching forward. And I'm going to hang out here for 3 breaths again. In through your nose and let it out. When you let it out, I want you reaching. In through your nose. Let it out, reach. One more time, in through your nose. Let it out and reach. Now we're going to take it to the side. So we're just doing our side to side. Doing that reach. We're in that same position. I'll turn and face you. Keep going. So you're bent over the same position. Now we're just taking it side to side. So we're still reaching. I'm reaching like I'm going to touch this screen in front of me. And I'm just gently going into my hips. Okay, we're going to work that whole body today. A little bit of mobility for all these joints that we've used all week. So just keep going, nice and easy. You're looking down to protect your spine, so you don't need to look up for this. If you already know what you're doing, just look down. Keep that spine neutral. Good, nice and easy. You're working in the range you have. Good, nice work. Alrighty. One more. Come on, let's get out of that position. Just because we were in flexion, hands on your hips, we'll go back into extension. Open up that chest. Open up into extension. All right, we're gonna go back into the hamstrings again, but in this position. So keeping those legs wide. Just want you to turn the feet. So I'm facing my left wall, and then I'm just gonna gently, in this triangle position, put my hands on either side of my feet. If you have this, that's great. If you do not, your hands are up here. If you feel like when you do this, again, that knee wants to bow, or it's too much on the knee, give yourself a little bit of bend. You don't need to be hyperextended. We're going to talk about that towards the end. Okay, so you don't need to be locked out here, or if you're in this position and it's hurting the back of your knee, I need you to bend that knee. Let it go. So you're here and you're just draping this side, and you're hanging out. Head is down to protect your spine. 3 breaths here. Let it out through that mouth. In through your nose. And let it out. In through your nose. And let it out. One more time, in. Let it out. So we're down. I want you to move that body to the middle. I'm turning my feet towards you. And now I'm just letting my head come down. If you can come down here, that's great. If you cannot, you're up here on your wrist. So whether it's on your knuckles like this, if you're having wrist pain, if you can put your hands down and it doesn't hurt you, then that's fine. Whatever you can do. Forearms, just let the head hang. You should feel this in your hamstrings, your adductors, the inner thigh. You're just relaxing here. By now, hopefully you've breathed out a lot of that tension. Your body can just let go and hang. And you're listening to your joints. There's no pain here. This is just a stretch. You might go deeper the longer you're here. It's okay. Whatever you can do, but you're not forcing it. That's the biggest part, is that we're not forcing this. Come back up to your wrist. Turn those feet over towards the right, and then drape that right leg. Head is down. Good job. And just breathe while you're here. Later on, I'm going to talk about posture. kind of different body positions, different ways we're built, and then how that relates to stretching. Okay, come back up, good. All right, now that I'm gonna come up, bring that blood back up. Good morning, everyone. So, we've done these. I want to do some hip circles while we're here. So, 5 open. We'll just go from internal to external. I want you to watch my foot. My foot's going in. I'm opening up, and my foot turns out. If you look at my foot, good. Foot goes in, open up, foot goes out. So just keep doing that. All right, nice and easy. This shouldn't be tension. If you feel like you're tight and you're like gripping to do this, use a wall. Okay, you don't need to be standing on one leg if you can't do it. If it hurts, we're gonna bend that knee. And in the hip, so mine clicks, it does, but that's from years of doing a lot of things. So the clicking isn't an issue. Now we're gonna go from out to in, so that same foot. So the foot was pointed up, we're bringing it in, placing it down to where we started. Turn that foot out, bring it in, place it in. The clicking is okay if there's no pain associated. I tell my patients all the time, I'm in my mid-40s, so there's gonna be some noise, gonna be some clicking and some clacking and then some loss of balance. That's what happens as we age. Some of this is normal and it's okay. The issue is if that clicking also feels painful, also causes, now I feel kind of numb, also causes instability, so it clicks and then you're like, I can't hold myself. That's different. Okay, so now we're going to the other leg. So start inward, bring that foot in, let the foot lead, turn it out, bring it back. Foot goes in, rotate your hip open, my foot is out, bring it in, keep going. This is 3, and then depending on our bodies, one side might feel easier, one side might feel harder, one side might click more than the other. It is okay. We need joint mobility, so this is actually good for that. As I do this, the clicking goes away. Why? Because I'm lubricating my joints, okay? The hip is a ball and socket. If you can think about that, it's literally rolling in a socket. All right, I'm done. So that's what we're gonna do, circles. Let's bring it up here and get our chest. So shoulder gaiters, and I'm just gonna talk. So in and out, and you're breathing. Notice my shoulders are down. I'm not up here doing this. I'm not rounded doing this. I'm here. I'm just open. Working on opening up the chest, stretching the upper back when I bring my elbows in, and then opening my chest as I go out. All right. So our joints, they need lubrication. That's why we move. So again, exercise is wonderful. Walking, cardio, strength training, shameless plug, doing all those things. I also recommend and encourage my clients in therapy. We do a lot of this stuff because it's kind of the foundation, and then we kind of go from there. We build up the strength from there. But this joint mobility is key, because if you don't have joint mobility, that's the reason a lot of people are in therapy, is because the joints are restricted. Some joint, the spine, the neck, the shoulder, the hip, low back, whatever's going on, there's a lack of movement between segments. So then here they are because they're stuck. They feel like they can't move. So they have this, say if it's low back, they're stuck here. I can't come up. I ask them to stand up and they do this. They can't go backwards. If you can't extend, which is this is extension. Think about walking. I'm just gonna walk. If I couldn't extend, how do I look? My hips don't move. Okay? If I cannot get into extension. If I can get into extension, my hips, I can get my legs to go back. Same thing with getting up out of a chair. Same thing with like going up the stairs. So we'll talk, I'm gonna go through this whole thing at the end. That changes in posture greatly will affect, we'll say greatly, it's a little drastic. They affect how you move in everyday life. So it's important that we can move. If it's a, I just don't want to stand up thing, that's one thing. But if it's a, I'm stuck here, that's a different story. So we just did our hip circles, okay, we did our shoulder gaiters. Let's go down to the ground. It's 8:45. All right, so I'm lying on my back. We're gonna do some hip circles, but they're gonna be on your back. So similar to what we just did in standing. So right leg, I want you to bring right knee towards your chest, rotate it out, push that foot away and bring it back to the middle. So bring it in, rotate it open, push it away, back to the middle. Good. So we're doing 10 of these. This is 3. Open, push away, back to the middle. Your back shouldn't be coming off the ground, so you're only working in the range you have. I had to tell a client the other day that I'm doing this a lot. I've been doing this with y'all for I don't know how many weeks now. And then I do some stuff after my workouts. So he was saying how he couldn't do a certain move, and I said, I wouldn't expect you to move your hips like that because I do this all the time, and you haven't been doing anything. So you can't just assume that your hips are going to move like this. Now, it's fine. Some of you might be extra mobile, and so this is easy for you. Let's do a few more here. Maybe one more. Good. Now we're doing the opposite, pushing down and bringing it out to the side and coming back in. So my point is, your back shouldn't be coming off the ground. It could mean that you're trying to rotate too much. So you're going to do what your body lets you do. Here we are. That's 3. Push down and around. Pull it in. That's 4. Good. 5. 6. Good. 7. 2 more here. 8. Nice work. Last one. 9. Sorry, I lied. And 10. Good job. Other hip. Okay. So we're starting out. Bring that leg out. Push that foot down in. 1. Good. Take it out. Push down. 2. Leg goes out. 3. So supine hip circles. 4. Some hip mobility. So this motion is called external rotation. Bring it into internal rotation. 5. These are the movements our hips have ability to do. 6. Okay, so we're just putting the hip into a motion that it is created to do. Some of us are tight here because we don't do this. I mean, I don't know, unless you're a hurdler or something, like I don't know why you would be doing this. So it's okay if this is not comfortable or if it feels really tight, that's fine. All right, now we're doing the opposite. Pull into your chest, internal rotation, take it out externally, bring it back into the middle. Good. Bring it in, open up, and around. Nice job. I think that's 4. Open. 5. 6. Good. 7. 8. 9. Last one. 10. So both the knees. Just give yourself a big hug with your knees. Pull them in. Arms out into a T. Let your knees fall to one side. So mine are going to the left. Yours can go to the left. Head is going to the right. So we'll just do a gentle lumbar twist. And back. I don't know if you can hear that. I have children running around. I try my best to keep them away, but I can't. All right, we're here. Nice and easy again. There should be no pain. Hopefully this just feels good after all of that we just did. We're going side to side. One more. Take it up. Rotate it to the opposite side. The head goes opposite of the knees. When you get there, just breathe. I need 3 breaths. In. Out. In. And out. In. And out. Good. Other side. Same thing. 3 breaths. And we'll get off the floor. Well, we'll just switch. In through your nose. And out. In. And out. One more in. And and out. Good. One more time. Pull those knees to chest. Give your little low back some love. So we're gonna end in hands and knees. Just do cat cow to child's pose, and then we'll chat. So pushing your back towards the ceiling, looking down, and then poking it out, looking up. And then I want you to sit down into child's pose. And then come up. So we're gonna do 5 of those. Okay? So press down. Cat. Looking up, camel. Poke it out. Sit back, child's pose. And again. Push down for cat. Poke it out for camel or cow, however you want to call it. And then sit down in a child's pose. Let that head drop. Let it go to the floor if it can. Let everything relax in the upper body. 2 more. Poke it out. And drop it down. Lastly, 1 more. So cat, push that up. Cow, poke it out. Look up, nice and easy, should not hurt. And just let it go down. And stay down here for 5 breaths. 5 belly breaths, okay? Your forehead's on the ground. Open up the knees if you need to. 5 breaths.